Hello, 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 and welcome back to another episode of the Charlie B podcast. My name is Charlene, better known as Charlie B, and I am so glad that you took out the time to join me. Today is the most special day of the Charlie B podcast. I'm feeling fancy. I got my blue on, and I came ready. Y'all have no idea. Y'all have no idea what's in store for you today. So, I met this beautiful young woman that you see on the screen. She is not a Barbie. She's not AI. She is real. She's actually this gorgeous for no apparent reason. Her name is Dr. Tamar Lawful. Tamar, say hello to the peoples.
Hello, everyone. Thank you for that wonderful introduction, Charlie.
So, Dr. Lawful, I call her Dr. T, I call her Doc, and she's probably not used to anybody as crazy as me, but she'll get there. So, I met her through a very dear friend of mine, is her auntie. So, we met years ago when you first started, and we all came online and we listened in. You did a nice little presentation, and we were like, okay, she's really good. But I don't know how many people followed up. And full circle, we're back here. We did the same thing, but now I was actually listening because I'm like, listen, I didn't even know about this because I'm 53 now. So Dr. Lawful is, let me get this right. I've told her before we started, I'm determined to get this right. She is a doctor of pharmacy, advanced practice pharmacist, and a certified nutrigenomics specialist.
Yes, that's it.
Nutrigenomics specialist. Don't act like everybody knew what that meant because I know y'all didn't. But we're going to learn today what that means, right? So that's what we're here to talk about. Dr. T, do you mind me calling you Dr. T?
That is perfectly fine, Charlie.
Okay, thank you. Don't let anybody else call you that. That's my name.
Only you.
That's my name. So she is a certified nutrigenomics specialist, and I said it fast that time, founder of LYFE Balance, a podcaster, a community volunteer, and a mom. How she has time for all of it, I do not know. So if you thought you were busy and you have not yet met this amazing young woman. Ladies and gentlemen, Dr. Tamar Lawful. I am so grateful that you took out the time and said yes to me today. Let's start with this. Who is Tamar Lawful?
Who is Tamar? You just starting deep, Charlie.
I know.
Jumping right in.
Listen, you got to get back to the baby, so we got to go. We got to do this.
Who is Tamar Lawful? I am a woman of faith. And a woman who just loves to help people better themselves so that they can enjoy this life that we have.
Mm-hmm.
Do it healthy.
Oh, I love it. And do it healthy. Okay.
Yes.
So now I'm going to give you a moment to introduce yourself. Tell us a little bit about your background, how you got into what you do every day. And we're going to start there. So tell us a little bit about you.
Yeah. So I started looking into being a pharmacist when I was a teenager. And at that time, my grandmother was dying of lung cancer. She was in Jamaica. My mom sent my brother and I to Jamaica to visit her because we knew she was dying. And I saw a frail woman laying on her deathbed. And I felt so helpless. There was nothing I could do. Grandma was going to die. There's nothing I could do. And in that moment is when I made that resolve to myself that whatever I do in life, I'm going to do something to help people with their health, to feel better, so that they hopefully don't have to end up like my grandmother, end of their life, right? She was in her 60s, when she died.
Oh, wow.
So I eventually had to start thinking about what kind of career will I get into that will help somebody. And I discovered pharmacy. And ironically, growing up in a Caribbean household, we didn't have a lot of medications. We relied on the bush teas and I didn't, my mom,
That's incredible.
day, and she said, you didn't get sick as a child. And I said,
That's
I know,
incredible.
I got sick one time and I remember it. And that's, so that's how significant it was that I didn't
Wow.
get sick. I remembered when I was sick, that one time in 4th grade.
One time in 4th grade.
Yes, I was sick. So we relied on natural medicine. So for me to become a pharmacist, it was out of curiosity as well, wanting to understand, how is it that these medications can help people? Is it real? Do they really work?
Right.
I went to pharmacy school at 18 years old and became a 6-year course. At age 24, I became a pharmacist. And for 15 years, working in a hospital setting, one day I said, I'm not helping people. They're not getting better.
Wait, I'm a pharmacist. I did this to help people. I'm giving them medication.
Yeah.
And they're not getting better.
They're not getting better.
That is so sad.
They're not getting better. They weren't getting better, Charlie. I would see people just continue 30 days later, 10 days later, 2 days later, they're coming back to the hospital. They're being put on more diabetes medications, more high blood pressure medications. The doses are being increased. They were not getting better. The disease was being maintained or it was getting worse. So I had to take a step back and think about what can I do? Because
Right.
in that particular setting, I was seeing patients. I was on a medical team. I was in charge of making sure they understood their medications. They understood their diagnosis. So before they were discharged, I would counsel them and talk to them and say, hey, focus on your nutrition, lower your salt, lower your carbs. And they'll say, okay, eat more vegetables. But then I'll see them back 3 days later.
Dear Lord.
So it made me realize that 10, 15 minutes I had with them wasn't enough, that people need a lot more extra help and someone to hold them accountable and also to guide them, because you can say eat healthy, but what does that really mean?
Absolutely.
And eating healthy is actually not the same for everybody, which is what takes us into genomics.
So, okay. You said something that struck us. You pulled a string. So you go to the hospital. You're meeting with a patient, and most pharmacists want to write that prescription. But you're telling people, listen, check your diet. You're giving them alternatives to medication, because sometimes if you check your diet, that could help. But even if that doesn't, you check your diet and it's still not working, you're still not getting better, then we go to genomics. So what triggered genomics for you?
Okay. Well, I want to clarify, yes, in a hospital setting, my job, it wasn't to write the prescription for them. The prescription is written by the doctor. My job is to tell them about that prescription that was written. And part of my job is also to encourage that lifestyle, the nutrition, exercise. But we don't get that much training in pharmacy school or even med school on nutrition and lifestyle. We're just tell them to do it. So the genomic portion.
Thank you for clearing that up. I do know that the doctor writes a prescription and the pharmacist fills it. So I just had a Charlie B moment, but we're going to move forward. So,
no, that's fine, because
but good, I'm glad you cleared that up.
Circumstances where pharmacists do write the prescriptions, and it's all, there's different things that we can do. So I just want to clarify that in my situation, I wasn't writing prescriptions at that time. So I decided to start my health coaching company outside of the hospital independently. I became an entrepreneur.
Okay, got it. Okay.
Because I saw that there was a need. People needed more help, more than that 15 minutes they had with me. So then I started my company, LYFE Balance, which stands for Love Yourself First Every Day. It's an acronym. It's spelled LYFE is how I spell life. Love Yourself First Every Day. And I incorporated
Love yourself first every day.
Yes, every day. And I incorporated genomics into the health coaching because through my training, now I'm skipping a whole lot of months and years here, but I
Yeah.
had extra training and realized that genetically, the food that we eat, even the environment we're in, the situations we're in, stressful situations, they don't change our genes, but they affect how well our genes work.
Mm-hmm.
Right? So based on how well our genes are working, we're going to present a certain way. We might be more prone to actually develop diabetes, type 2 diabetes. We might be more prone to develop high blood pressure or high cholesterol if our environment is not appropriate and the foods that we're eating are not appropriate. And so that's where genomics came in as a great tool to help people really tap into what's going on with them inside their bodies on a cellular level, help them understand their blueprint, their God-given blueprint, the blueprint they were designed with, so that they now can know where to focus on their health.
Did you already know about genomics and what genomics was, or did something happen and you're like, oh, let's look into genomics?
Well, let me tell you how I got into genomics then. I'm going to make it very brief. So when I decided I'm going to help people as a health coach, I'm going to bring my pharmacist knowledge with the medications.
Right.
People are coming to me on medications, but I'm also going to coach you, with nutrition and exercise. I wanted to know more about nutrition because, like I said, as a pharmacist, we don't get a lot of training. So I went to an integrative nutrition health coaching school. Where all the health coaching is centered around nutrition. And then from there, I really got interested in ketogenic nutrition. Right?
Okay, you just like learning and reading.
I'm just learning, exactly. I'm just absorbing everything I can about nutrition. And then through my training on keto, learning keto for medical uses, because it was originally used to prevent seizures in children. And
keto?
Yes. It's actually a form of therapy right now.
Okay.
Yeah. So we, through that training is where I read one sentence that says the food we eat affects our DNA. And I was like, what? How? What? It does?
And now we're getting to the root. Okay.
Yeah.
Got it.
So one sentence mentioned the word nutrigenomics, and I said, well, I'm going to learn about nutrigenomics.
That makes sense, because I was trying to figure out, well, what made her want to go into genomics? Like, most people, if they're honest, have never even heard of it.
Yeah.
So where did it come from? How did she know about it? And now I know.
Yeah.
Because what we eat could affect our DNA. Who would have thought?
Who would have thought? And it wasn't a far reach for me to understand that, because when you think about it, you take a medication, it has an effect.
Yes.
On you. The same way you eat food, it's going to have an effect on you. The food is actually turning on or off our DNA. Think about a light switch on or off. Right? So our DNA is what it is. It's not going to change, but it can be off, and that it's not going to work to produce certain signals to tell our body to do certain things. Eating certain foods can turn off our genetic ability to produce those signals, or
we don't even know.
And we don't know. So this was mind blowing to me when I learned this and found out.
So some people will never know, because they don't even know that I love apple pie. But apple pie could be the cause of whatever is going on in my body.
Right. It could be the cause.
Wow. Okay.
But someone else can eat apple pie and be completely fine, because genetically they can handle the sugars perfectly well and not have a problem. Yeah. So it really comes down to our genetics. And then on the other hand, it wasn't a far stretch for me to understand it, because I was also trained in what we call pharmacogenomics, where we look at genetics to determine if a medication is going to be safe and effective for you. So there are certain medications that now the FDA requires that genetic testing is done before a doctor prescribes it.
Really?
There are oncology cancer medications that are now based on your genetics. So you're going to have a genetic test, and they're going to know whether or not you should even get that type of chemotherapy. You know, so
Interesting.
that's pharmacogenomics. So I already understood that genetics, based on how our genes are, we're going to respond well to a medication
Right.
or not respond well to a medication. We might be more prone to have side effects from medication or not based on our genetics. So that was something I already understood. So why wouldn't food have the same effect?
Right.
Why wouldn't food? Yeah.
Man. Okay. That's mind blowing. And when I think about it, we just eat. Oh, we just eat. Like we don't think about if we like it, we eat it. Chicken. If you say you need a meat, a starch, and a vegetable, and then dessert if you want it, right? But just do
Right.
that in there because why not have dessert, right?
Yeah.
But we don't even know what's harming us.
We don't even know. We don't know. And I mean, we in general, we do know, like, sugar, too much sugar is not good for you. Too much salt is not good for you.
I wasn't ready to go there yet. Because
We can backtrack, but I just want to put that out there. So in general, we know some generals, right? But like I
yes,
said,
yes,
everyone is different. We're designed uniquely by
right.
God's design. So yeah, we respond differently to things.
I love that. So what I mean is like my daughter, she has a shellfish allergy.
Mhm.
We didn't know for quite some time because not that she's a lover of shellfish, but my aunt, my sister would make crabs. I don't like the smell of crabs and all that seafood, but she would have a seafood party and invite her over. She would go eat and get sick. And then be like, you ate too much. Never did it dawn on us that the child has an allergy
Oh
to
yeah.
it. And come to find out she's allergic. So
Mhm.
that's different than you eating. We love chicken, but what if there's something in the chicken that could be affecting me and I don't even know it? That's more of what I mean, but we
Yeah.
don't, you know.
So when it comes to chicken or even vegetables, what I look at and teach with my clients is that's why we favor organic food.
Hmm.
They don't have all the pesticides and the chemicals
Right.
in them. It's those pesticides and chemicals that can also affect our genetics, how well
Hmm.
our genes are going to work. And so we encourage organic foods. We encourage non-genetically modified food, um, organic, cage-free eggs or chickens, grass-fed beef, because if we're going to consume those things, we're going to get the best source of nutrients
Right. That
and
makes sense.
risk of exposure to the chemicals that can actually impact how well our genes work.
Right. We talked about um this, is it the sweet truth? The truth about sweets, the sweet truth.
Right. I did the sweet truth presentation, not the sweet tooth, the sweet truth.
That that was tough for me, Doc,
Oh, yeah.
because I am a sweets junkie. I am a junk food junkie. And we talked about just because you're small doesn't mean you're healthy.
Mm, yeah.
And I don't eat bad. I don't eat a lot, but when I eat probably more bad stuff. I don't want to say more bad stuff than good stuff. I eat too much sweets. And I've
Mm,
been thinking about it for ever since you did the presentation, and I'm like, what am I going to do? And I have cut back quite a bit,
okay.
but I still eat a lot of sweets.
Mhm.
And then when we had our one-on-one, I was just like, oh dear Lord. So what I wanted to do was put myself on the spotlight today.
Okay, let's do it, Charlie.
And you told me some of the things that I was worried about with me is I get migraines. And
Hmm.
my mother was in the beginning stages of dementia when she passed. And I shared with you that is one of my biggest fears,
Hmm.
ending up with dementia. I do not want to go down that road. And some of the things that you told me, I was just like, and also my cholesterol. I went to the doctor and my cholesterol was elevated. I weigh 145 pounds. I'm 5'3". Why is my cholesterol elevated. It's just not fair, right? And you said, do you know that sweets can contribute? And I was like, I did not need to hear that. I didn't want to hear that. But I can't stop thinking about it. So let's talk about that a little bit. Just educate the audience on the dangers of this thing called sweets that we sometimes go to as I deserve it. I'm treat myself, but we over treat. So let's talk about that a little bit.
Exactly. Everything in moderation, right? And when it comes to enjoying sweets, there's nothing wrong with that because we have a lot of healthy alternatives.
Right.
Right. But definitely in moderation. So education-wise, in the presentation, if you recall, I talked about insulin resistance, and I'll just recap that with our audience today. When we eat naturally after our body, food is in our body, it's going to turn to sugar.
Right.
And in a response to sugar being present in our bloodstream, our pancreas is going to release insulin. Insulin's job is to tell the tissues in our body to open your doors and let the sugar out of the blood so that these levels can go down and normalize.
Mm-hmm.
Now, in insulin resistance, it's not that your body isn't producing insulin anymore. Your body is still producing insulin. What happens is the resistance is from those tissues. They're not opening their doors. They're not responding to insulin signal. So insulin is like, hey, I said, open your door.
Stay in here.
No, we're good. We're going to stay closed.
Oh,
so what happens is there is going to be buildup of sugar in your bloodstream.
Oh my gosh.
That's where we have that high glucose, that high blood pressure. Insulin resistance actually happens years before someone is even diagnosed with prediabetes or diabetes. Insulin resistance can be going on for a decade at least before a diagnosis is made.
What in the world?
Because we measure blood sugar levels, not insulin levels. When you go to the doctor, right?
Wow.
So as a result of that extra sugar in the bloodstream, it's eventually it has to go somewhere.
Right.
So it's going to try to go into the kidneys, and that's where you see people having renal issues.
Yeah.
Diabetics have issues with eyesight. And so it's going into organs that it shouldn't really be in, and we start having those issues.
Oh my goodness.
Yeah. And yeah, so that's the problem with sugar, having too much sugar. And then if you are genetically predisposed to not being able to really handle sugar, you're more likely to have diabetes or develop diabetes.
Wow, let me tell you why this all makes sense for me. For everybody, but for me. My father was diabetic, and he ended up dying for renal failure. His kidneys failed. He had very bad eye problems. His feet came to a point at the end, maybe the last 3 or 4 years of his life, where they literally had to start cutting off slice. They didn't cut his the heel off, but they would have to start slicing off because it was, there was dying and it wasn't getting enough circulation. So he would have to go regularly and get the heel of his foot literally sliced off. They would take a knife and cut some of it off. I'm talking about flesh.
Yeah.
And then they would wrap it real good and send him on his way. And all these things started with sugar until he ended up dying. And what amazes me is there's 7 of us. 5 of us have high blood pressure. I don't. Thank you, Lord. I don't have high blood pressure issues.
Yeah.
But most of my siblings do. So all these things, when you talk about genetics and DNA, and I don't know if it's true that because if your parents get it, you're predisposed to it, or you can get it too. So we're always just thinking about that kind of thing. So I want to talk about how we can know why your work is so amazing. And I'm not comparing you to Maury Povich, but you take the guesswork out. You do a test and you no longer have to guess. You are the father. You do have this. Like what you do is, I can't believe that more people don't know about it and they're not running in droves towards it. Like, I need to know what's going on inside. I don't have to take 7 different tests. I can just do this and then I will know. Don't take D3, take this. Don't take that, take this. I will actually be able to know what I need to eat, please.
Yes, exactly. Why guess when you can test?
Oh, say that again.
Why guess when you can test?
You are the father.
I love it. But before I answer that, I do want to go back to, you say, it's in the family. You say it might be passed down.
Mm-hmm.
Yeah, genes are passed down. So you might have a gene, like I was mentioning, there are genes that have been researched that might predispose you to having developing diabetes or high blood pressure.
Okay.
However, what was that phrase I shared in our Sweet Truth presentation, which was, your genetics load the gun, but your lifestyle pulls the trigger. Okay.
I love it.
Your genetics, they're there. Like I said, they're not going to change. It's there. It's coded. But the things that you do, how you live your life, the food you eat, are you active? Are you stressed? That is a lifestyle that will pull the trigger and start turning that gene on or off to now not working as efficiently for your body, where you're going to be more likely to develop diabetes. You're going to be more likely to develop insulin resistance, which is going to eventually lead to diabetes as well.
Could it be laying dormant and then you trigger it?
It's not that it's dormant. It's your genes are there, right?
Okay.
How well is your gene going to work? Like, what we do can support our genes, how we're coded.
Okay.
So let me explain this. So there is a gene, the FTO gene. It's related to how we metabolize fat. It helps. It's even our appetite, where fat is going to be distributed in our body. Are we going to have it more in our arms, more in our chest, or in our back? But if you're eating a high fat diet, then that gene is going to be, you're feeding that gene pretty much, I want to say.
Wow.
Right? But if you're eating more lean and clean, that gene's going to be like, okay, I'm here, but there's nothing for me to do because you're not giving me fat.
Wow. Oh, goodness gracious. It makes perfect sense. Because as soon as that gene gets it, it's going to be like, thank you, yum, 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 and start eating it away. And now you're like, and now you're dealing with inflammation or whatever will come with it.
Right. And
I get it.
Yeah, because our genes, their purpose is to code for certain things to happen.
Mm-hmm.
But those things are not going to happen if we're not feeding that environment, making it a viable environment for it to happen.
Right.
Okay. Yeah.
Right.
That's what it comes down to. So
That's
I wanted
good.
to just get back to that.
I'm glad you did.
Load the gun, but your lifestyle pulls the trigger.
Wow.
Yeah.
That is good. You need a T-shirt that says that.
I don't remember. I know I'm quoting somebody. I don't remember.
Oh, you didn't. I was going to say put Dr. T at the bottom of it.
I think
but that's okay. You can still make a T-shirt. Maybe I'll just do it. Is this true? It's a reminder. Don't pull the trigger, Charlene.
Yeah, I have to find out where that original quote came from, and then of course you can still make T-shirts.
Yeah,
under it, and there you go. And the other thing with nutrigenomic testing. Why guess when you can test? And you're exactly right. It's a cheek swab. No blood drawn, no needles involved. It's so easy. We send the test to your house, cheek swab. Within 4 or 5 weeks, we get this result. And it's going to tell us, the company that I use, I love them, 3x4 Genetics, because as a practitioner, they're educating me continuously. They're helping me learn all the time how I can help my clients. And why I say clients and the patients is probably a whole nother podcast, but it's all about accountability.
Right.
So I call those I work with clients and instead of patients. And you get a report that's identifying areas in your I'll just say your cellular health that if focused on can really optimize your health. For example, let's use inflammation. It might show that you have an inflammation pathway that, if tackled, really will help optimize your health. And then from there, it's going to give you very specific nutrition recommendations on what you can eat to support that inflammation pathway even more. What type of exercises would be best for you? Stress management techniques that would be best for you. And also supplements that could be used to help with stress or help with that inflammation pathway.
Right.
And once that inflammation pathway is now being optimized and being able to work to the fullest to really help you reduce inflammation, it's going to be a catalyst effect where now you're going to see some other improvements. You're not going to have that joint pain anymore because inflammation is being addressed.
Wow.
It's going to be easier to lose weight when inflammation is addressed. And many people realize that inflammation has a huge part to do with the difficulty, weight loss resistance, the difficulty to lose weight. When your body's inflamed, the fat cells pretty much cannot be released, so you can't lose weight. But once that inflammation is addressed, the weight starts melting off.
Interesting, because you feel better.
You feel better.
You're not inflamed.
You can be more active. You're not in pain. You're not swollen. You're not puffy. You know, inflammation has its hands in so many different type of chronic illnesses as well. So.
Okay. Well, yes. So after the test comes back, you get a blueprint of Charlene.
Yes.
So you're able to tell Charlene exactly. Now you mentioned there's process that I have to follow in order to be successful at it.
Yes.
To start feeling better. And you mentioned exercise and all the things that go with it. You also talked about a person that was exercising too hard, and that because it feels good and you can doesn't mean you should.
Right.
So this Nutrigenetics can tell you if you are exercising too hard.
It can.
That is crazy.
And this is where I usually see it show up when a client when their genetic report shows that oxidative stress is an area of high impact. So if they focus on this oxidative stress pathway, it will help optimize their health. So think of oxidative stress like rust on your cells.
Yeah.
Like your cells have rust. So, they're not able to have the energy and make the energy they need to. So think about it as stress on your cells, right? So if you're going to this high intensity workout 5 days a week, that is more stress on your body. Your body doesn't know if it's running from a lion or it's just doing some push-ups. Stress is stress.
Wow, that's so good.
So it's going to build up, and then you go, you do your high intensity workout, then you go to your high stress job. It's piled on. Then you come home and you have to take care of family. Then you go to bed, but you had to go to bed late because you have so much going on. You only got 4 hours of sleep. So it piles on and piles on. So when it comes to exercise, oxidative stress, exercise can impact that. So that you might learn, I have clients who learn, okay, it's a high intensity workout. It's not that it's bad. It's just that for them, they shouldn't do it as often. So once or twice a week is enough. Workouts like yoga or Pilates or swimming would be best for them for weight loss, for stress management, all around. Yeah.
Wow. So then you see those people who I've been working out, I've been dieting, I've been exercising, I've been doing all the things, and I'm still not losing weight.
And they wonder why. Now they know.
Why stress when you can test? Did I get it right?
Why guess? Why guess? I got you, Charlie. I got you.
Why guess when you can test? Why? Yes, people. What?
my God.
Listen. Oh, so exercising, eating right, doing all the things, still not losing weight because you're busy guessing.
Yeah.
When all you have to do is take this test and
All
it
you have
will
to
tell
do.
you no more guessing. And so
Mhm.
many people have felt better because of this. So why don't you give us some life examples of or maybe one good life example of somebody that this actually worked for?
Oh, I will give you an example of, let's say her name because she's given permission to. With Sylvia, she suffered from autoimmune disease. And for over a year, she's worked with her doctors. She's been on the medications
Mm-hmm.
to help with the inflammation, the pain, and her markers. They check inflammatory markers. They were just, you look at the chart and it's just
Oh,
just
goodness.
straight
Yeah.
up. So she works with me for 3 months and has her levels checked again. Mind you, during that 3-month time, it didn't take long for improvement to be seen. She was able to reduce the amount of pain medication she was on, as well as she no longer needed one of the medications she was taking for autoimmune disease. And when
Oh,
they did
wow.
her anti-inflammatory markers, you saw the graph that straight,
Oh,
all of a sudden it was like
oh
down.
my gosh, that's so awesome.
So inflammation was something that we did work on. It was one of the pathways the test picked up that was something would be of high impact on her health to optimize her health if we focused on that. So with that, of course, the nutrition is a huge part of it.
Mm-hmm.
Additionally, in my program, I provide a meal planner that is linked to their genetic test results. So it makes it easier
Wow.
to know what to eat. Because I'm going to tell you, when you look at the nutrition recommendations, you might see cocoa, garlic, onions, berries, kale. What do you
Ice
do with that,
cream.
Charlie? What do you do with that?
What
What kind of
what
meal do
what
you
do
make with
I do?
that?
What do I do with it? I'm gonna be like, I know, thank you for the results, but you know what? We're gonna just move on, and I'm going to give me a bowl of ice cream.
Exactly.
Wow. So
Exactly.
you actually follow the people and keep them encouraged and help them along the way?
Yeah, so my full program is a 90-day program. I have a 6-month and a 12-month program as well. The 12-month is more private, one-on-one, but the 3 and 6-month programs are group coaching programs. Every week we meet for an hour, and
Oh.
yeah, every week we meet for an hour. But in between our weekly sessions, they have me. But this is a concierge service, so they're able to message me in our portal and my team if they have a question. Like, hi, I'm in
Nice.
aisle 9, and I see this bar. Here's a picture of it. Should I eat it? And
How, wait, how do you keep up? You have to have a team that
I
does
have
this.
a team. I have a
Okay, good.
team. Yes.
Okay.
So, and then of course you have to set boundaries. So 9 a.m. to 5 p.m. You can contact
Okay.
me Monday through Friday anytime. And
Okay.
and then also we have a group, a private group where in our portal where we are our team is always encouraging them, educating them, and they can jump
Wow.
in and ask questions or share if they don't want to text personally, they can message the group. This is what I experienced today. What do you guys think? So you get that support
I love it.
between our sessions. And then we have our 1-hour weekly sessions where I have a protocol that I put everyone through. And we're going through that protocol. It's a lifestyle protocol because it's needed. You
Yeah.
want to make sure that you're getting the sleep, that you are stressing less, that you are not feeling guilty for taking care of yourself, that you are loving yourself first every day.
Yes.
It's very important that we do that, especially as women. And
Yes.
a lot of my clients, they're high achieving women. They excel in their careers, they excel in life. So why not excel in your health?
Yes. First. Why isn't our health first? Love yourself. Well, first every day. Like,
Yeah,
why do we have to be told that?
because we forget, and it's okay. That's why I'm here
So
to help you remember
I'm
that.
loving, yes, I love that. And I love that it's a concierge service. Like
Mm-hmm.
it needs to be, because so many times people get discouraged and they're like, listen, oh, I can't do this. It's too much. I like, I know I'm the daddy, but I don't know that kid really. And I don't like his mama. So that kid gonna be all right. It just literally happens that way. This is
Yeah.
DNA. And it just blew my mind. I've been thinking about it that way. Like, you don't have to wonder. You know this belongs to you. These are your issues, and here's how we can help you fix them.
And let me tell you, Charlie, I could easily not do the genetic test, genomic test. And I used to offer that option. If you don't want to do the genomic test, perfectly fine. We'll still put you through the 90-day health coaching program without the personalization, without the customization based on your blueprint. But what I found was the clients that did not do their genetic test, they did not stick with the plan. Those who did their genomic test because it was coming from them, this is what
Yep.
my body's telling me I need to do and how to go about doing it, 100% success rate in reaching their goals.
Wow. Because you don't have to guess.
You don't have
You
to.
take you literally take the guesswork out.
Right.
You're telling them, it's like my name. My name is Charlene Patrice Holmes. I don't have to guess about that. This is what it is.
Yes.
This is what it is. Nutrigenomic testing.
Yeah.
We're about to wrap it up. Do you want to talk about what do you want to talk about this? You want to finish off with the sweet truth or your ebook? Because
I would love to. Well, let's do both. So the sweet
let's go.
presentation, I thoroughly enjoyed meeting with your group and
awesome.
doing that presentation for you, and the feedback you guys gave me was phenomenal. So as a result of that, I will be doing the Sweet Truth presentation on Eventbrite.
No way.
Yeah, so once I set that up, I will share the link with you. So whoever's listening, they can tune into it and listen to that presentation as well. I'm going to do it live for a few presentations so that people can join and I ask me questions and interact. So I will share that link with you.
That is awesome. Go.
Yeah. And the ebook, I'm going to share the link with you as well so they can get it.
Yay! That's even better. That's even better. Listen, guys, you need to contact. We're going to get all your contact information. How, if you're interested, which you should be interested in getting a consultation with Dr. T, you can reach out to her, because who doesn't want to know what's going on? Who's tired of wondering why? I know I've been getting headaches for years, but why? Why am I feeling sluggish? Why can't I lose weight? Why am I feeling this way? Why do my knees hurt? She'll tell you.
Yeah.
Not she. The DNA testing. I lost the word.
You got it.
I did.
Nutrigenomic testing.
Nutrigenomic testing will tell you exactly why. Mm-hmm. I'm telling you, I don't think I've heard of anything more amazing than this. You just take it all out. And so many times, the world that we live in today, so many people are sick.
So many.
You don't meet too many people that are healthy. Like, oh, I don't have any issues. You don't. I've met a few in my day, but I don't need two hands. I don't need I don't even need to use my thumb. I could do it on one hand. Of how many people that I met that are just healthy. And that's sad. And it's getting worse, right? So we can change that. It starts with us.
Right.
It starts with us reaching out to Dr. T. And her.
Reach out. Contact me if you have any questions, you're curious, you want to get some direction. If you know anybody who could use some direction in their health, just reach out to me. We have a free initial consultation.
And how can they reach out to you?
Visit me at www.thelifebalance.com. That's THELYFE balance.com. And you click on any of those buttons and it'll take you to an appointment with me.
Awesome sauce. Any closing remarks? One thing that I do want to share is that Dr. T does these these live sessions on LinkedIn. They're short, sweet, and to the point. So if you run late getting logged in, you're gonna miss it. But you can watch it. You can watch it still, and they are so informative. I absolutely love going on and watching, and I appreciate you sharing this information with us because we need to know. I want to feel better.
Yeah, we
Yeah.
should. And we all deserve to. And if there's a way to do it, why not? Why not figure it out? Thanks for sharing about the LinkedIn Lives. The replays are there. You'll be able to watch them even if you can't attend the live. So they'll be there in my profile at Dr. Tamar Lawful on LinkedIn. Actually, Tamar, yeah, the handle is at Dr. Tamar Lawful on LinkedIn.
Lovely. Are you on Facebook and all that other stuff? Is there anything else you want to share? I'm going to put everything in the bio when I post this amazing episode.
The Facebook, LinkedIn at Dr. Tamar Lawful.
Got it.
YouTube, the LYFE Balance on YouTube.
Oh, and she's a podcaster. What's the name of your podcast?
Podcast is Raise the Script with Nutrigenomics.
Raise the Script with Listen, you're doing all the things. I don't know how you do it, looking as beautiful as you do. And like I said in the beginning, it's really her. She's not AI. She's really that gorgeous. And I just appreciate you sharing this information with us. We need to know. We need to know.
Thank you. And I appreciate you having me and also having this platform for women out there on all the things that's needed. We need to hear the conversations that need to be had.
That's right. That's right. We're doing it. We're doing it. Listen, everybody, this has been an amazing episode with Dr. Tamar Lawful. You know how to reach out to her. I'm going to share some information. You're going to get a copy of her ebook, and she's doing the sweets. This truth about the sweets. Say it one more time. The sweet truth. The sweet truth.
Yeah.
The sweet truth on Eventbrite. You do not want to miss that. You do not want to miss it. As soon as it comes out, I'm going to share it with everybody. I might even do a little live. TikTok has been telling me I need to do more lives. Yeah, we'll see the way my life is set up. We'll see. Thank you so much for tuning in tonight. Join me next time right here on the Charlie B podcast. Charlie B out. Bye.
I loved it.
Thank you. That was so awesome.